So in this video, we're going to be talking about how you should be studying for the NCLEX. And in this video, we're going to cover a secret for studying for the NCLEX, how I personally studied, some general tips, as well as some specific topics you should be focusing on. So I feel the secret for studying for the NCLEX is the fact that you already know how to study. You've gone through the school. You've had countless tests that you've written, countless exams, countless quizzes, and you know what has helped you to study to get through those quizzes. Because if you're at the point where you're studying for the NCLEX, you've obviously passed all of those challenges and obstacles. Some people, they learn through reading. They read their textbook. Some people, they learn through going to lectures. They just absorb the information from their professors. Some love doing practice questions. It's some people like writing notes out. Some people there's a million different ways to study, and what you've done to get yourself to this point is something you should continue through studying for the NCLEX. How I personally studied is basically what I did was questions, because I know that throughout university I just hated reading. I'd never opened my textbook once, pretty much. So things like the Saunders book, I have it. It's sitting on my desk right next to me. I have not opened it. I didn't even crack the book open. Things like writing notes for some people, I know my friends, they go through the textbook. They write out their condensed notes. They love it. That's how they learn. That wasn't for me. I just couldn't do it. Like I said, I'd love to do practice questions, and I would go through the primary one I went through was UWorld, and then after I completed UWorld, I did the RN Mastery app. And when I was going through both of those, I would make my notes of important things I learned or things that I needed to learn that I recognized were weaknesses or topics that I just had no idea of what they were. I would write down on like a Word document. I would write it down on, and that's pretty much all I did to study. It was almost all just purely questions and learning from the rationales. So there are a couple other really important tips that you should be using for studying for your NCLEX, and the most important one I did was to make a schedule. And this helped me because I was doing the UWorld questions for the most part, and I wanted to get them done before a certain date in order for myself to be able to write the self-assessments that were included in the UWorld package. So if, for example, it was the Sunday, I wanted the UWorld done, say, at 3 weeks later, 4 weeks later, let's say. I would mark that out on a calendar. I would mark the next Sunday being the self-assessment day. So I would book the whole day off to write the self-assessment just so I knew where I stood. And then I would cross off what days I knew I would be busy. Say the Friday I had a birthday party. I can't study. 0 questions are going to get done today. And every day that would go by, I would write down how many questions I studied. So say the Monday I did 150. Next day, say the questions were harder. I only did 75. And I would know how to pace myself in order to achieve my goal. It's really important to set that goal so you work towards achieving it. Another thing a schedule is really helpful for is when you actually book your NCLEX. When you book your NCLEX, it's important to say you got to write it down on the calendar, and then you know how far you are away from the exam and how much you need to fit into time prior to taking your exam. Another important study tip is to understand trends and patterns in what questions are looking for. For example, I recommend doing, say, if you're doing UWorld questions, do all the cardiac at the same time, and you're going to notice the trends of what they're looking for in fluid volume overload. It's a common trend, things to be looking out for, and basically the biggest thing is safety for the NCLEX. Is a safety exam. Notice the safety trends that you're going to need to know in order to be successful in your exam. And in the previous slides I mentioned that to tailor your study program to how you learn. For example, I literally have never opened a textbook throughout all of university. I'm not going to start now. I know that's not how I learn. I learn by doing practice questions. And even if that's not how you learn primarily, it's highly recommended for you to incorporate at least some practice questions into your study routine. And one of the statistics that I read while getting ready for my NCLEX is the fact that it's recommended if people who do 3,500 questions or more have a high probability of passing the NCLEX when it comes time to write it. So that's definitely something you should be keeping in mind. So there are some topics that you should be focusing on heavily for the NCLEX. But it's important to remember that every exam is different. I could do a video based on the questions I got on my exam, and it's going to be different than anybody else's experience because the test is pretty much random and unique for every individual. But there are some topics that are seen in almost every single exam. First of which is infection control. I had a lot of infection control on my exam, and it's important to know the precautions for the major illnesses. Is this person airborne? Is this person droplet? Is this person, do you require a N95 mask when you enter this person's room? It's very important to know things like that, as well as what rooms can an individual with an infectious illness be paired with. For example, a MRSA patient can be paired with another MRSA patient because you can't get MRSA twice. Things like that, it's important to understand because the NCLEX focuses heavily on infection control. Another one is to know at least the basic information about the major illnesses such as TB, multiple sclerosis, Alzheimer's, and definitely the endocrine disorders. These are topics that the NCLEX loves to focus on. Make sure you know at least a little bit about them. You don't need to know everything about them, but enough for you to be able to critical think and use your judgment if you get a question about one of these disorders on the NCLEX. And medications. Some people, they don't get many medications on their test. I, for example, had tons. I had a lot of medications on my test. And basically, you need to know the endings of the medications, and this will give you what excuse me, what category they're from, and from that you can know the major side effects of each and every category. So it makes it easier for you to understand. And you also need to learn the major medications that you know they're going to be calling on. You know they're going to be calling on digoxin toxicity, as well as individuals who have a low heart rate who are taking digoxin. You know they're going to be calling on lithium levels for lithium toxicity. Magnesium is another big one, and deep tendon reflexes. Knowing the major things to look for in some of the bigger medications that are discussed more frequently. And the final tip I have for everybody is to not give up. It's studying for the NCLEX can be demoralizing at some point, but you have to do it. You've done your school. It's time to write it. And even if you fail, you can just study and write again. It sets you back at least 45 days. I know in Canada is the wait time you have to wait before rewriting. So what? You've already put in up to 4 years, sometimes even more, of school. You're going to survive another 45 days if you fail. There's no need to get discouraged. Just keep going, keep trying, keep writing. You're going to pass it at some point. And that's pretty much it. Thanks for watching. Just subscribe for new videos every week. And comment below if you have any stories for how you study for your own NCLEX.